Zoll recognizes that pediatric patients are not small adults. We have developed a dedicated pediatric arrhythmia analysis algorithm that can distinguish shockable versus non-shockable pediatric rhythms. The R-Series detects whether pediatric or adult electrodes are connected and automatically adjusts the arrhythmia analysis. For children under 8 years of age and under 55 pounds or 25 kilograms, use one-step pediatric CPR electrodes. To place the one-step pediatric CPR electrode, place the back electrode first. Grasp the electrode at the bottom and peel from the plastic liner by lifting the red tab at the base of the electrode. Place the electrode so that it is centered on the spine. Turn the patient and apply the front electrode over the cardiac apex. Avoid any contact between the nipple and gel treatment area. When these electrodes are connected, the R-Series screen displays a pediatric label, compression rate and depth on the CPR dashboard, and filters compression artifact from the ECG waveform. Pediatric CPR electrodes do not enable CPR voice prompts or any visual indication of ineffective CPR. The default defibrillation energy protocol for pediatric patients is 50, 70, 85 joules. Use only pediatric electrodes designed to switch to the pediatric algorithm with the R-Series to defibrillate patients under 8 years of age in advisory and AED modes. Use of adult electrodes or pediatric electrodes not designed to switch to the pediatric algorithm with the R-Series can result in the delivery of adult energy levels. If pediatric defibrillation electrodes which are not designed to switch to the pediatric algorithm are used, defibrillator energies must be set manually based on site-specific institutional protocols for pediatric defibrillation. If needed, external paddles can be used to shock the patient. Pediatric-size electrodes are built into the paddle assembly beneath the standard electrode plates. Energy settings must manually be adjusted to pediatric levels consistent with institution protocols. Review the R-Series operator's guides to learn more about shocking procedures with external paddles. To expose the pediatric plate, press the black PD button at the top of the paddle. Then slide the adult plate upward. Before replacing the adult plate, be sure to clean the pediatric plate and surrounding area thoroughly. Slide the adult plate onto the paddle until it locks into place. If pediatric patients need to be paced, using the one-step pediatric CPR or PD-PADS 2 requires the use of a separate ECG cable, as these electrodes do not include the built-in 3-lead capabilities. Non-invasive pacing of pediatric patients is performed in an identical manner to adult pacing. Advanced monitoring options for the R-Series include NIBP, SpO2, and end-tidal CO2. Use appropriate accessories when obtaining these measurements. A patient type for NIBP measurements can be selected. The patient type setting determines the default cuff inflation pressure, as well as default alarm limits for high-low systolic, diastolic, and mean blood pressure values. Unless configured otherwise, the R-Series defaults to adult patient mode when initially powered on. To change the patient type setting, press the Param soft key. Press the NIBP soft key. Press the NIBP PT type soft key, and then press the NIBP PED soft key to select the appropriate patient type setting.